The parvoviruses are our final group of DNA viruses. These are small, non-enveloped or naked, single-stranded DNA viruses. So that's a little bit different from the double-stranded DNA viruses that we've already talked about. Parvoviruses must infect actively dividing cells, or they have to co-infect with a helper virus. So based on what we've learned about viral biology to this point, why do you think that is? What do the parvoviruses need that they lack, which makes them have to infect either an actively dividing cell or co-infect with another virus? The replication of parvoviruses is relatively similar to other DNA-based viruses. The viral DNA goes into the nucleus where it will replicate and be transcribed and then packaged into viral particles for release. We typically think of parvoviruses as animal viruses, dogs and cats. There are two parvoviruses that are known to infect humans, B19 and Boca parvovirus, or sometimes called Boca virus, depending on the text you're looking at. Boca parvovirus is really uncommon, but B19 is far more common. Approximately 60% of adults have had B19 by the age of 40. What we see, this is the B19 cycle. It's a respiratory virus, local replication, and then replication in erythroid precursor cells in the bone marrow, viremia, rash, joint pain. In a normal host, you might have a slight drop in hemoglobin levels because of the replication in the red blood cell precursors. In hosts that have any sort of like anemia condition, this can be life-threatening. What we tend to see in patients is that the cytotoxicity, so the virus causing death of the host cells, but also the immune response is what is going to lead to the rashes, the joint pain, and the arthritis. And patients with sickle cell are at major risk. So based on what we've just talked about, based on this image in the slide, why do you think that is? In humans, this is most common in children. They call it Fifth's disease because there's a set of bacterial and viral infections that can cause a full body rash. This is the fifth one. It's also sometimes called slap cheek because the children who have the virus, they develop a rash on their cheeks that looks like they've been slapped in the cheek, but they haven't because the redness doesn't go away for a while. Again, it's fairly contagious, relatively common. A lot of times children won't even go to the physician because they'll clear the infection on their own, non-specific kind of flu-like symptoms, fever, headache, chills, muscle pain. The rash, though, can be what would signal a caregiver to take the child to the physician. I know this is one that my brother and I had, and the only reason that my mom took us to the doctor, because kids get sick all the time, is because we both had that redness in our cheeks. Diagnosis is usually on symptoms that our doctor didn't do anything else but look at us and go, yeah, it's Fifth disease. However, you could test for specific antibodies or for the presence of viral DNA. There is no treatment or control for human disease, again, for the most part, because it is so mild. But for your patients that have any sort of anemia condition, those are going to be the ones that you really want to look out for. And of course, if you have pets, you should always vaccinate your pets for parvovirus because it can cause lethal GI infections in puppies and kittens.